Member for North Coast.
As BC's Parliamentary Secretary for Emergency Preparedness, I encourage individuals to learn about the risks in your area, to make a plan and build or buy an emergency kit, to always have a minimum of 3 days, but preferably at least 1 week of food and water and other essentials such as prescription medications on hand. This is good practice preparing for any type of hazard, whether that's a power outage, fire, flood, earthquake, or disease outbreak. So I find myself in a bit of dilemma when I see British Columbians rush out in a flurry of fear-driven stockpiling because of anxiety around the coronavirus. It's always wise to be prepared, but the most important measures people can take today to prevent the spread of coronavirus or COVID-19 is to proactively prevent the transmission of respiratory illness, including COVID-19. This includes washing your hands regularly, avoid touching your face, cough or sneeze into your elbow sleeve, and dispose of tissues appropriately. Besides healthcare professionals, masks should be only used by the sick to prevent transmission to other people. It may be less effective to wear a mask in the community when a person is not sick themselves. Masks may give a person a false sense of security and are likely to increase the number of times a person will touch their own face, for example, to adjust the mask. It's also very important to stay home and away from others if you or your family are sick. Travelers should monitor the Government of Canada travel site for the latest travel advisories. While the risk of spread of COVID-19 within British Columbia remains low at this time, we continue widespread testing by screening British Columbians and travelers with symptoms, along with their close contacts, to identify cases. In BC, we continue to be in active containment mode to detect cases and respond to prevent the virus from spreading in the community. The Ministry of Health, the BC Centre for Disease Control, working with many partners, including EMBC, have plans in place and are prepared to respond to new illnesses of public health concern. I always encourage people to be prepared, but this should be done in a measured approach and not be panic-driven. Thank you.